Hi, I'm Dr. Edwin Williams here from Williams Plastic Surgery Specialist, just to share with you what we refer to as a sliver blepharoplasty or a sliver eyelid tuck, which has become a fairly popular procedure. What people like about it is there are a lot of folks who will have a non-surgical procedure and they're not really ready for something surgical. So the sliver is just removing a small amount of skin from either the upper or lower eyelids. For those people who start to get crepiness, some textural things, and are not really ready for the full blepharoplasty. Why do people like it? They like it because it's quite honestly very easy to go through. It's a procedure that takes about 30 or 40 minutes. It can be done on just the upper eyelids, where we gather up a little bit of upper eyelid skin, or a smidgen of eyelid skin from the lower eyelid. It's done under local anesthesia. Typically the patients will have one of the nurses hold their hand as we go through the procedure. A lot of patients will often tell us it's easier than going to the dentist. There'll be a very, very fine suture line right below the lower eyelid or in an upper eyelid crease. Very delicate suture that stays in place for about 6 or 7 days, and that's removed. Patients typically either take Tylenol or nothing for pain, and will often describe it as a feeling of like having just a little bit of a paper cut. Bruising is minimal. As far as the recovery, it's typically a 2 or 3 day recovery, even though the sutures remain in place for 5 or 6 days, where patients have minimal bruising. And as far as the recovery goes, we leave sutures in place for 5 or 6 days. Most patients really have about 2 or 3 days of out of the public eye. Sometimes people will put a pair of glasses on just to camouflage it, but it's really pretty easy to go through. So I hope that's given you some information as to what we refer to as a sliver blepharoplasty and why it's so popular.